to be discussing the topic of osteoporosis. Osteoporosis is characterized by a decrease in the density of bone. As density decreases, it's reducing the strength and resulting in fragile or weak bones. Osteoporosis leads to abnormal bones that become like a type of sponge-like material versus a healthy bone which is strong and very dense. This disorder weakens the bone and results in fractures or breaks in the bone. The most common areas that osteoporosis affects are the spine, the hips, the ribs, and the wrists.
Molly, what population is most affected by osteoporosis?
Normally, bone density accumulates during childhood and peaks around age 25, but at about age 35, both men and women start seeing a decline in bone density, and about between 0.3 and 0.5% of bone density is lost as part of the normal aging process every year. But in particular, women are at greater risk for osteoporosis because estrogen is extremely important in maintaining bone density. And as women hit menopause, estrogen levels greatly start to reduce. So during the first 10 years after menopause, women can suffer up to 2 to 4% loss per year, and this can result in up to 25 to 30% over that time period. Generally, osteoporosis affects both men and women, but is more common in most menopausal women. How is it developed?
Your risk factor goes up by 58% if another family member has osteoporosis. Age is also a huge factor. As Molly said, the average loss of bone mass decreases by 5% every year at the age of 50. Unhealthy lifestyle is a huge factor as well. Smoking, excessive alcohol, and caffeine intake, or low amounts of calcium and vitamin D both decrease bone mass. Chronic disease such as rheumatoid arthritis and hypothyroidism are other factors, and medications that people take, such as steroids or blood thinners, lead to bone mass.
Symptoms don't usually occur until a bone fracture, so osteoporosis often goes undetected. And some of the symptoms that can be noticed are early menopause, a loss of height, bone breakage more easily than usual, stooped posture from collapse of vertebrae, and chronic lower back pain from fractures. Those that suffer from osteoporosis can also experience something called minimal trauma, which is a fracture that occurs during normal activity. An example of minimal trauma is a stress fracture in the foot just from simply walking. Also, they experience hip fractures more commonly as a result of falling, and these fractures may heal slowly or poorly because of poor healing of the bones. Once these symptoms are noticed, how does one get diagnosed?
The diagnosis for osteoporosis is sort of a simple test that it's a dual energy test that tests the uniformity of bones called a DEXA scan. The results are given by a T-score, which is used to predict fracture risk. If the T-score is lower than negative 2.5, the patient has osteoporosis. If the T-score is between negative 1 and negative 2, it's just that it means that the bones have a high risk of fracture. And Lauren, how is it treated?
The easiest treatment is just changing one's lifestyle, such as eating better and exercising on a regular basis. It's also recommended to take calcium and vitamin D supplements. There are also medications available, and the most common one used for women in post-menopausal state is bisphosphonates. In addition, estrogen and calcitonin are available. So, Melissa, how does the diet affect osteoporosis?
Well, as we've mentioned, calcium is a very important dietary factor to prevent osteoporosis. It's recommended that women 19 to 50 get about 1,000 milligrams of calcium in their diet per day, and after 51, women should get 1,200 milligrams per day. So good sources of calcium include milk. A cup of milk is about 300 milligrams of calcium. Yogurt is a great source of calcium, as is low-fat cheeses such as string cheese. We also have products now that are fortified. Fortified orange juices are very popular. If you feel you don't have enough dairy products in your diet, you may want to look at a supplement. For lactose intolerant people who may not include many dairy products per day, they should know that Leafy greens are also a good source of calcium, such as broccoli, romaine lettuce. Soy milks are often fortified with calcium, so you'll want to look for that. Calcium fortified soy milks, almond milks, coconut milks, and rice milks are a good idea to include in the diet. Lactose intolerant people also may want to look at getting a lactate supplement to ease their symptoms, or they may be able to tolerate small amounts of yogurt or aged cheeses that have lower content of lactose. On the other hand, we do have some foods that are that aid bone loss. So foods you want to avoid in preventing osteoporosis, and that includes sodas, anything high in caffeine, high salt foods, and also high amounts of alcohol can also lead to more bone loss. Because calcium is better absorbed in an acidic environment, the stomach's natural acid environment, anyone who's on long-term antacids, acid-reducing medicines may have inhibited calcium absorption. They may want to talk to their doctor about getting a calcium supplement. Vitamin D is another factor that aids in calcium absorption and stronger bones. We get most of our vitamin D from the sun. Our body makes it naturally during the winter, and for those who may not go outdoors very often and get enough vitamin D, they may want to look at a vitamin D calcium combination supplement or fortified foods such as the orange juice that also has vitamin D. So in conclusion, as we've discussed today, the best way to prevent osteoporosis is to change your diet and lifestyle factors. Some things you can do without the diet is going to be weight-bearing exercises, not smoking, and keeping your BMI within a healthy weight range. It's because osteoporosis is naturally occurring throughout the life cycle, just as a product of aging. It's good to start these lifestyle behaviors and dietary behaviors early rather than later.